I wanted to ask this question about how our faith, um, and in terms of religious context, affects our mental health, and how our belief systems also affect our mental health, and how can we undertake certain measures to be aware about what our voice is and what is not, to know our needs.
Neha, culture, shaped us, right?
Yeah.
How we are and what we behave. What is our behavior towards life, worldview? There are many things I can say that a religion plays a vital role, right? So, in terms of raising awareness, for mental health or any other spectrums we have discussed related to mental health, yes, I think the role of religious people is very important. We need to incorporate these people because culture impact everything, as I said earlier, including our beliefs, our behavior, our practices, our worldview, and even the stigma and discrimination related to mental health, right? So, because we want to we want to improve understanding about mental health, we want to raise awareness. Mental health, yes, why not? They are very, they have very influential people, right? People follow them, right? Blindly, sometimes people follow them, right? So we need to consider this. Yes, it's a very important thing, and because there are many challenges in terms of mental health. We can address. In terms of using faith-based leaders, like seeking or avoiding treatment, right? In terms of mental health, um, perception of mental health, how they express, emotions, right? In terms of mental health, how they cope with the stress in their life. Stress is a kind of another reality everyone is going through. It's different, in the different transition of their life. Stress, it's a another real thing. In terms of adherence of the treatment, they can play a role, because a lot of stigma, as I said, a discrimination attached with mental health. So we need, I'm considering we need to consider how we can involve them in this biggest challenge we have, because cultural competency is important in terms of reducing mental health disparities. As I said, how we can respect diversity, because we are living in a multicultural society. This is another reality. um, we can promote how to create effective communication, right? In terms of talking about mental health concern, the real concerns. We can promote non-judgmental environment, right? In terms of mental health, we can build some cultural, appropriate assessment tools, intervention, right? And data, for sure, we need data, right? What is going on, what are the percentage in terms of suicidal, domestic violence, depression, anxiety, bipolar, a lot of things, right? We have right now, I don't know, there are I'm not saying data is there, it's a lack of data, right? We need to be a part of these kind of researches, right? We have to promote, we have to initiate these kind of initiatives, right? In continuing education, and we need to impact through these people, like procedures, policies, they are making for mental health promotion and awareness, and people are like feeling comfortable to talk about and consider these things. So yes, we can consider these religious people and religious places, right? Because it's not only like it is not like a challenge for us only, it is challenge for everyone.
So, when we were talking about, um, people and signs and symptoms, how to notice them, or like you said, warning signs to notice in ourselves
Mm-hmm.
and our loved ones.
Mm-hmm.
Um, if there is a break, in terms of the sleep, eating, losing interest in daily activities or hygiene, we notice it. Do you
Even
think?
losing weight and gaining weight, right? It's a
Yeah,
consideration, right?
yeah. So do you think, um, you know, a happy person or a cheerful, bubbly person, um, could be depressed, or I must not say depressed is the right word, but could be facing certain mental health conditions?
Yes, yes, 100%. Because sometimes we have to pretend,
Yeah.
playing a kind of a double role, right, in society, right? So
Yeah.
yes, it is. I am considering it's a kind of a another struggle, and we need to consider it's if it is more than the real behavior. Yes, we need to consider. Yes, I can say that it maybe behind these behaviors there must be something. As I said, anger, we have to explore what is behind this anger, right? Anger is not like, yes, it is a simple emotion, right? But I can't say this is the right or good behavior or bad, right, a thing, right? But yes, we have to explore what is behind. It is a kind of a symptom. We need to consider all these things in terms of assessment.
Okay. So that's all I had for today. And
Okay.
thank you for joining Book My Therapy. It was a pleasure having you.
Thank you. Thank you. I'm hoping, we will, do something positive and good, and it will make a kind of a difference, in the society.